Good day, my name is Wim Teugels, and the discussion of today is about a recently published paper that my colleague David Herrera from the Complutense University in Madrid and Ariane van Winkelhoff, emeritus at the University of Groningen, and I co-authored. The article examines Europe's involvement in the assessment of systemic antimicrobial therapy for periodontitis and was published in Perio 2000. With an emphasis on the European context, the document provides a comprehensive overview of the use of systemic antimicrobials in the treatment of periodontal disease. Periodontitis is the most frequent chronic non-communicable human disease. It is caused by dysbiotic bacterial biofilms and is commonly treated with subgingival instrumentation. However, some sites or patients do not respond adequately, and its limitations and shortcomings have been recognized. This has led to the development of alternative or adjunctive therapies. One is the use of antimicrobials to target bacteria in subgingival biofilms in the periodontal pocket, which can be targeted directly through the pocket entrance with a locally delivered antibiotic or systemically by oral, intravenous, or intramuscular methods. Since the early 20th century, several studies on systemic antibiotics have been undertaken and published, especially between 1919 and 2010. Europe's latest contribution to this topic is the first European Federation of Periodontology S3 level clinical practice guideline, which incorporates recommendations related to the use of adjuncts to treat stage 1 to 3 periodontitis. The paper emphasizes the importance of evidence-based research, systematic reviews, and meta-analysis in guiding clinical practice and decision-making in healthcare. The European Federation of Periodontology has played a significant role in establishing a stable foundation for periodontal practice, particularly through the development of clinical practice guidelines. However, the document also highlights the limitations of systematic reviews and meta-analysis, such as reporting quality, heterogeneity, and potential biases, which can make it difficult to draw general clinical recommendations regarding the use of systemic antimicrobials as adjuncts to scaling and root planing in the treatment of periodontitis. So the use of systemic antimicrobials in the treatment of periodontitis is analyzed, focusing on their impact on clinical outcomes. The paper explores several key aspects related to the use of systemic antimicrobials in the treatment of periodontitis, summarizing a series of studies and workshops. The analysis includes the impact of dental biofilms on antimicrobial resistance and the effectiveness of systemic antimicrobials as a monotherapy for periodontitis. The paper emphasizes the need for skilled clinicians, instrumentation over a short period of time, and timely antimicrobial administration to achieve the best results. It also highlights the potential side effects, antimicrobial resistance issues, and the individualized assessment required for the prescription of systemic antimicrobials in periodontal therapy. The findings suggest that systemic antimicrobials should only be used in specific patients or conditions such as aggressive periodontitis, severe or progressing forms due to their side effects. It addresses challenges and recommendations related to the use of systemic antimicrobials in periodontal therapy. It also discusses the need for further research to compare different adjunctive antibiotic strategies, identify the best phase of periodontal treatment for systemic antimicrobials, and determine the most effective approach for using adjunctive systemic antimicrobials with periodontal surgery. Overall, the paper provides a comprehensive overview of the current understanding and challenges related to the use of systemic antimicrobials in the treatment of periodontitis, emphasizing the importance of evidence-based approaches and individualized patient assessment in dental practice. Furthermore, the paper presents the transition of European workshops in the 21st century and their impact on advancing the understanding of periodontal diseases and their treatment. The evolving approach to systemic antimicrobial therapy, including the evaluation of different antimicrobials, doses, and administration routes, is emphasized. The paper highlights the importance of randomized controlled trials to assess the adverse effects of systemic antimicrobial therapy, as well as the impact of antimicrobial use on subgingival biofilm debridement quality and the treatment outcomes. However, current recommendations are restrictive due to concerns about antibiotic misuse and the increase in microbial antibiotic resistance. European researchers have contributed to the use of systemic antimicrobials in the treatment of periodontitis through clinical trials and by providing rational guidelines. Nowadays, European researchers are exploring alternatives and directing clinical practice by providing evidence-based guidelines to limit the use of systemic antimicrobials.